It's our pleasure today to introduce you to Dr. Claudia Mark, who's doing some research on smoking and MS. I'm Andrea Salmon. I'll facilitate today's webinar, and Claudia is online with us as well. We start all our programs by acknowledging and paying respect to the traditional custodians, past, present and emerging, on whose lands we meet today, no matter where we are. We acknowledge the deep feelings of attachment and the relationship of Aboriginal people to country, and we respect the cultural authority of the elders in each community. Dr. Claudia Mark is a Senior Research Fellow in the Disability and Health Unit at the University of Melbourne. Claudia's work focuses on how health behaviours and other modifiable factors influence the health and wellbeing of people living with multiple sclerosis. She has published more than 40 papers on MS and regularly presents her work at national and international MS conferences. Claudia receives funding from the National Health and Medical Research Council Fellowship and grants from the University of Melbourne, MS Research Australia, the Melbourne Disability Institute and QUIT to carry out her research on MS. It's our pleasure to have you today, Claudia, and these are just a couple of slides that we remind people that we're talking about research, not necessarily specific strategies, and you should always get further advice before for your situation. So I'm going to click a couple of buttons here and swap over and make Claudia the presenter.
Great. Thank you very much for that introduction, Andrea, and good morning to everyone. So I would also like to start by just acknowledging the traditional custodians of the land where my home is, where I'm working today. That's the Yalukut Wilam clan of the Boonwurrung, and I pay my respect to their elders, past and present, and their emerging leaders. All right, so let's see if this works. Yes, so first, I just wanted to start by saying that until 2005, I used to smoke a pack a day. So I quit smoking about 15 years ago after several attempts. So I know how hard it can be to quit smoking. So studies have reported that nicotine is actually in the top 3 most addictive substances. It's right up there with crack cocaine and heroin. So it's incredibly difficult to quit smoking. So if you're a current smoker and you are struggling to quit, I am not here to make you feel guilty in any way. So just over to this large infographic here in the middle, and I'm not going to go into all the details because you should have received the handout so you can read all the information in more detail later. I just wanted to point out that the tobacco industry is very cunning. So they actually use quite a lot of tricks to get people hooked on cigarettes and to make it very difficult to quit smoking. So for instance, you can see that they use certain chemicals to enhance the addictive qualities of nicotine, such as ammonia, and that they also use design features such as filters to get the smoke even deeper into your system. So once you try to quit smoking, you will likely experience nicotine withdrawal effects, such as irritability or headache, which generally makes you want to light another cigarette, and that's what makes it so difficult to stop smoking. These physical withdrawal effects will usually become much less after a few days, so after 2 or 3 days, and they are usually gone within 2 to 4 weeks. So we haven't got a lot of people online at the moment, but we'll still go to the first poll, if that's all right, Andrea. Hang on, somehow I can't click to the next one. Oh, there we go. So this is the first poll, and I think Andrea will pop that on the screen. So just curious of the people that are here this morning, how many of you are current smokers or ex-smokers, or whether you've never smoked? So I'll give you a second to complete that.
That's great. Yep, that should be up on people's screen. And if you want to use your mouse to click, a few people are joining us. So if you're just joining us, that's a poll that's up on the screen that you can participate in. I can see probably maybe one person left to vote on that.
Great, thanks for voting, everyone. Again, I'm not here to make you feel guilty if you're a smoker or an ex-smoker, it doesn't matter. Just here to share information. So just
cool.
curious.
That's everyone. I'll close that off.
Thank you.
And we can see that, you can see that, I'm sure.
Yep. So we've got a couple of smokers, and most of you have never smoked but are still here for the information, which is great. And again, we've got people here joining us live, but we'll be recording this session and sharing it online for other people to see later as well. So I want to tell you something in this slide about the research on how smoking affects the risk of developing MS. So there are several studies that have looked at this around the world, and the evidence is fairly conclusive here that smoking tobacco increases the risk of developing MS. So passive smoking as well. So that means being around people that smoke, for instance, sharing a house with someone that smokes inside, or being in a car with someone that smokes in a car. So being exposed to passive smoking also increases the risk of developing MS. Now, this is especially important for children of people with MS who may be at a slightly higher risk of developing MS themselves due to genetic vulnerability. Particularly one study that I've cited here below has showed that children whose parents smoked around them had a higher risk of developing MS at a young age, called pediatric MS, and that the longer that these children were exposed to smoke, the higher the risk of developing MS was. So we'll go to the next slide if that's okay. Now, a question that you may have is, once you have been diagnosed with MS, does it still matter whether you smoke or not? Well, the answer is yes, it does. And there is, again, quite a bit of evidence to support this. So there's just a few things that I wanted to highlight here. So first of all, as we age, all of us, our brains slowly shrink a little bit over time. And smoking has been shown to speed up this process because the smoke that you inhale causes injury to brain cells day in, day out. So that shrinking process is actually sped up. Smoking also impacts on how effective MS medications are. So there's been 2 studies that have specifically looked at natalizumab and interferon beta, and have shown that these medications that are designed to slow down MS and to prevent relapses are not as effective in people who smoke. And because these medications are really important, as we know, in helping people slow down their MS, we don't want to interfere with their efficacy. So that's the third point on this slide. Sorry, the second point on this slide. So the third point, there's been quite a few studies that have followed people with MS over long periods of time. And they have compared people who continue to smoke and compare them with people who, for instance, quit at the time of diagnosis. And they've shown that people who continue to smoke develop walking difficulties quicker than those who quit at time of diagnosis. Another study also showed that people with relapsing remitting MS who continue to smoke reach the progressive stage of MS, so secondary progressive MS, much quicker than those who didn't smoke. Now, the final point, and I won't go into that too much, but most of us know that smokers generally die younger than people who don't smoke. And this is also the case for people with MS. So there's a study that have shown that people with MS who smoke generally die younger than people with MS who don't smoke. So we'll go to the next screen then. So we know that there are many benefits of quitting, and I've just highlighted a couple here. You might need to click next. Yep. So, for instance, it slows down progression. So I've already talked about this a little bit, but quitting at any time, at any age, or at any stage of MS is likely to slow down your MS. So quitting is very beneficial no matter your age or the stage of MS you're in. So just click next, Andrea, thanks. It also lowers the risk of other diseases. So we know, for instance, lung cancer, but also cardiovascular disease. The risk of those are higher if you are a smoker. Next one. Now, in this day and age, as we are here in lockdown in Melbourne, it is also important to consider that if you become infected with COVID-19, smokers become much, much sicker than those who don't smoke. So the severity of COVID-19 infection it's much worse in smokers. So it's time for another poll, Andrea, if you could move on to the next slide. So I'm just curious for the couple of people that are here who are current smokers, what is stopping you at the moment from quitting? So I'll just give you a little bit of time to.
So the options on here is that it's too stressful, or that you're worried about your symptoms getting worse. Maybe you don't know how to quit. Maybe you don't feel supported, or maybe it's I don't want to quit. So you've got an option there. And maybe for the people that are not smokers, maybe could guess or predict what they think people might find as barriers to stopping them quitting.
Yeah.
And
So if you're helping people with MS, for instance, to quit, what is the most common concern that you hear from them?
So that's fabulous. About half the group have voted, but feel free to put in your votes. A couple more people want to contribute to this. I know it's tricky when if you're not a smoker to kind of, you know, have that guess, but it'll all add to the conversation. That's great. That's nearly everyone. Last votes in. I'll close that off and I'll show you the results.
Great. Yeah. So most people are saying they don't want to quit. Okay, that's interesting. Don't feel supported. I don't know how, or it's too stressful. All right. We'll move to the next slide, if that's okay, Andrea.
Yeah.
Because I have been doing some work in this area, and some of this research was funded by MS Research Australia and Quit Victoria, and also the University of Melbourne. But we have, and some people who are here today may have participated in this research. So if you have, thank you very much. We have conducted interviews with people with MS who are current smokers or who have recently quit, and we've recently also done an online survey of Australians with MS. So if you click next, Andrea. So some of the things on this slide are from the research we've conducted, and some we also know from the literature. But what we were told is that many of the people that took part in the research told us that they were not aware at all of the impact that smoking can have on MS. So they weren't aware of the link between smoking and MS. And once we did tell them, they said that it might help them motivate to quit smoking. And I guess the other interesting thing to mention is that from the poll, we saw that most people said they may not want to quit. The interesting thing from my research is that we found that most people actually did want to quit, and they were also had many quitting attempts in the previous years, and had somehow gone back to smoking. So for us, it will be really important to see how we can maximize the success rate of once people actually try to quit, how we can help them to stay quit. Yeah, so the second point on the screen here is that many people told us that their doctors or nurses had never asked them whether they smoked, they had never advised them to quit, and they hadn't offered them any sort of support to quit. And we think that this is a huge missed opportunity, especially general practitioners should be able to help you quit and give you support on how to do that best. So the next point on the slide is that many people did try to quit quite often. However, they weren't using the most effective way to quit. So, for instance, quitting cold turkey can work for some people, but for most people, the most effective way to quit and to stay quit is to use a combination of quitting medication with behavioral counseling. So this can, for instance, be through a psychologist, through an experienced general practitioner, or through a quitline counselor. And we'll come back to that point a little bit later. The other thing that we were told by many people with MS is that common symptoms that they experience, such as pain, depression, anxiety, or brain fog, felt to them that made it much harder to quit. And I'll give you an example of this on the next slide. So if you follow along with me from the top and then go clockwise around, if you imagine someone with chronic pain, and we know that people with chronic pain are more likely to smoke, they might light up a cigarette, which temporarily dulls the pain a little bit. So that's just temporarily, because in the long term, smoking actually increases the risk for chronic pain. So when people try to quit in that green box, they may temporarily after that be more sensitive to pain. So people might think their pain is getting worse, but it's actually that you're just a little bit more sensitive to it temporarily after quitting. So that makes it then much more tempting to go back to smoking, which may dull the pain a little bit temporarily. However, we know that it makes their pain worse in the long term. So you can probably imagine a similar sort of vicious cycle for other common MS symptoms like anxiety or depressive symptoms, where in the short term it might seem like your symptoms are getting a little bit better, but in the long term it's actually making them worse. So I guess the conclusion here is that you may need a little bit more help to quit if you have these symptoms, because you may be temporarily more sensitive to these symptoms. Yeah, we can go to the next slide, Andrea, thanks. Yeah, so if you go to the next one, So we're just getting to some common myths and concerns here. For instance, the first one that we commonly heard from people with MS is that they thought that nicotine was the bad guy and that nicotine is the harmful substance in cigarettes. And we know that while nicotine is actually the addictive substance in tobacco, studies have shown that nicotine itself is not what causes the harm to your health. It's actually the other chemicals and the smoke that do the harm. And this is really important to know because it means that nicotine replacement products like gum or spray or the chewing gum which are very helpful for quitting, are actually quite safe to use for people with MS, even in the long term. So these nicotine replacement therapies can be very helpful to help you quit. However, it is important to note that you might still experience some withdrawal symptoms from the nicotine, even if you are using those products. There are no known interactions with MS medications and these nicotine replacement products or any other quitting medications. So they are safe to use for people with MS. And other quitting medications can include prescription medications like Zyban or Chantix, which your GP can prescribe for you. And so as I said, there are no known interactions with MS medications. So the next point, which I've already touched on a little bit in a previous slide, is it too late for me to quit? Well, the answer is no. Quitting has benefits at any stage, any age, any phase of your MS. As I've mentioned before, it has long-term health benefits for cancer, cardiovascular disease, but also for your MS. So the next point, or the next question that we got sometimes from people in the interviews was whether e-cigarettes or vapors are safe. So there is currently no evidence suggests that these products are not harmful. So they haven't been around long enough to know exactly what the long-term health consequences are, but the current advice is not to use them unless they are prescribed by your doctor specifically as a temporary tool to quit smoking. I should probably also mention that they are actually illegal in Australia unless they're prescribed by a doctor. So the last point on this slide, does quitting make my MS symptoms worse? So I've already shown you a little bit in that sort of vicious cycle slide that I had up before, is that, you may have some short-term sensitivities, or you may have short-term nicotine withdrawal effects, which can sometimes be confused with symptoms. And so you might in the short term need a little bit more help getting on top of your symptoms. For instance, if you feel like you're more sensitive to pain, you might need more help getting on top of those symptoms and manage them a little bit closely. But in the long term, quitting will benefit your health. So we might go to the next slide. We know from research that you have a much better chance of quitting successfully and long-term if you use a combination of quitting medication and counseling. So it's really important also that you feel supported to quit. So your general practitioner can prescribe medication to help you quit. And there are also lots of phone apps, and there's the Quit line, and these are really helpful supports for most people as well. So some of these apps that you can download, for instance, the My Quit Buddy app, and I think the Quit line has an app, and I'm sure there's many others as well. They will show you, for instance, what health benefits you can notice the longer you go without cigarettes, but also how much money and time you're saving by not smoking. Might also be really important to tell your friends and your family about the benefits of quitting on your MS and your symptoms. And this might help motivate them to support you to stay quit. And it's really important, of course, that you feel supported by the people that you spend the most time with. So please have a look at all these resources and find help in them. So we'll go to the next slide. So my research has uncovered some really interesting findings in this area, and I'm also really keen to hear your opinions at the end of this and have a bit of a discussion if we've got time. So if you click next, Andrea, to ensure that we support people with MS who want to quit as best we can, I'm working closely together with Quit, here Quit in Victoria, but also with MS Australia and with MS Research Australia. And we've got a few things to help help get the most support out there for people with MS. So the first one on the screen here is to train quitline staff about MS, so that if you are someone with MS and you call the quitline staff, that they understand what MS is, that they know what the symptoms are, what sort of medications you might be using, and what common concerns are. So the next point that we want to do is we want to train MS nurses and neurologists to help you to support you to quit. So we want them to ask you whether you're smoking, to advise you to quit, and to actually offer some practical support where you can go. The next one is to provide information about the benefits of quitting to people with MS and their families. So like what we're doing today. And the last point is to strengthen the links between MS societies and quit services. So we'll go to the next slide. So I just also wanted to put in context that quitting smoking and avoiding passive smoking is just one part of healthy behavior, which also includes looking after your mental health, being physically active, and enjoying a healthy diet. Now, I know that MS Limited, but also MS Research Australia, for instance, has a range of resources online, such as podcasts and webinars on these topics. And just to repeat it once more, it is actually very hard to make changes in habits by yourself without any help. Almost everyone needs a little bit of help to change habits and behaviors, especially if they are, ingrained behaviors and habits. So please do ask for help and find support in anyone you can get support from. So we'll go to the final poll, and then we'll open it up for questions and a bit of discussion as well. So I'm just curious how the smokers in the room feel now about quitting. And Andrea will show you these options on the screen. So whether you feel ready, you have the support that you need, whether you're ready to quit and you'll seek support, whether you're thinking about quitting, whether you're not ready to quit, or whether you have already quit and you feel good about it. There might be other options too, but these are the ones we've got.
That's great, and the responses are coming in, so thank you for that. That's, again, it's possibly a bit hard to answer if you're not a smoker, but yes. That's the responses that have come in are great. So last call for voting on that one, and I'll close that poll off and show you the results. It's really encouraging to see what people are thinking and feeling.
Great. So some people are saying they're thinking about it, which is wonderful. So I would definitely advise them to find more information and to talk to their healthcare professionals about it. Also, those who are ready and will seek support, I'm very happy to hear that. And, congratulations to those people who have already quit and feel good about it.
That's great. Thanks, Claudia.
So I'll take any questions if there are any. I know that
we're absolutely. So I'm going to go through a couple more slides, giving people the chance to put their questions in. So this is the question that Claudia's encouraging you to have a think about. What has or would help you to quit smoking? And some acknowledgement here of people that have been involved in the research and some references. These are all in your handouts. And so I'll just go through a couple of slides, again, giving you that chance to type into the question area a comment or some feedback or some ideas. And just remind everyone that MS Connect is also here for support and for help. So never feel that we're far away. We're only ever a phone call away. And peer support comes into that support as well. And Claudia was mentioning the importance of support. We can offer one-on-one phone support. Maybe it's connecting with a group of people. At the moment, many have actually gone back to meeting in person, but we've got lots of telephone groups, and people are finding those really helpful as well, because you can connect with people no matter where you are, no matter, the state you live in, or how your symptoms might be impacting. You can connect with people by telephone, and they're fabulous. There's a couple of tools that are in the handout pack, the Get Your Act Together tool. And just to let you know about other supports and services we have, the Employment Support Service is here to support you if you are in the workforce and worried about your symptoms or your MS impacting your work. We're an NDIS provider, so you can get some support through the MS Connect line for your NDIS plan. There's a range of podcasts, and I'm encouraging Claudia to work with us on developing a podcast, so watch out for that soon. And My Aged Care, if you're over 65, it might be My Aged Care where you need a bit of advice and support, and we can help you with that as well. So let's check out the questions. How have people gone with typing in questions or comments? Absolutely. All right. Thank you very much, Claudia. The information you've presented has been fantastic. It's something we've been aware of, but so great to get the detail and the background so clearly presented. That's been fantastic.
Oh, thank you.
Penny made a comment that last time she quit smoking, she used e-cigarettes, and that was when she had her first flare-up and got diagnosed. So I'm going to add to that, Penny, I'm wondering if you have then continued to try to quit, or whether that has almost psychologically been a challenge for you. Claudia, do you want to make any comment on that?
Yeah, I mean, it's always difficult to comment on people's personal situations because there's so many factors to take into consideration. I know that some people do try vaping to try and quit smoking, and I would always suggest to talk to your doctor about it, because I can't give any medical advice about it. In the long term, it is better for your health to not use any type of vaping or e-cigarettes. I guess that's the common advice, by the WHO and other health organizations, is that it is not completely harmless. Yeah.
Thank you. And it's interesting, we often, if we have an experience, we connect it then that will be the ongoing experience. And Penny, if you are still smoking, we would encourage you to give it a go again, to quit and to seek support to do that.
Absolutely.
That's all that's come in. Oh, here we go. Penny managed to stay quit for over 12 months with e-cigarettes, but eventually the cravings won. Now she smokes addictive-free or organic tobacco. Not ideal, but her health has remained stable since then.
Okay. I mean, it does often take people a couple of goes or quite a few attempts to quit, and you do get better at it. It takes a bit of practice. And so I would still encourage you to, I'm not aware of this type of tobacco, but I would definitely encourage you to seek some support and see if you can try it again. Yeah.
Yeah, I really appreciated a couple of the comments that you made, everything you said actually, but I picked up on the sharing your desire to quit with your friends and family, so that and the reasons why you're wanting to quit, so that they can help you in that. That would be huge, I would imagine. And the piece too about the cost, for some people it's different motivators on why they're motivated to quit. So those apps look really interesting too.
Yeah, and some people comment on the nicotine replacement therapies. So for instance, the gums or the sprays or the patches or whatever you'd like to use, that they can be expensive. But if you look at the long-term costs of those versus cigarettes, it's very, very beneficial to use them over cigarettes. Yeah.
Yeah, fantastic. Thank you, everyone. Thanks so much for being part of today. And if you're wanting more support, don't hesitate to reach out for support, whether you're participating in the webinar live, whether you're listening to this later. The support is available, and that's what we're here for. So thank you so much, Claudia, for your time. And we will look forward to the podcast, because we'll work on that together as well.
Yeah, absolutely. Thank you very much. Thanks, everyone.
No problem. Thank you again. Look forward to seeing everyone at future webinars. And again, thank you, Claudia, for your time.
Thanks.
Goodbye for now.
Bye.